Coming up today, empowering men to take charge of their health. Hear what men in the community say about their biggest medical concerns and the stigma that comes with asking for help. Plus, a new study linking tattoos to cancer. But do the news headlines match the science? Hear a lymphoma expert react to the research. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. There is a disconnect sometimes between men and health care. Numerous studies have shown that men are less likely to seek medical help than women, and that's largely attributed to stereotypes about masculinity. Some men often feel seeing a doctor can make them seem weak or vulnerable. Maybe they can just tough it out. But as we begin Men's Health Month, we want to encourage men to keep tabs on their health and get help before a problem arises. I went out into the community to ask men about the stigma and what their biggest health concerns are. We're going to react to some of their comments with our doctors this morning. But first, let's get to our morning rounds on this Monday. A recent study has labeled tattoos as a risk factor for a certain type of cancer, malignant lymphoma. And it generated numerous headlines last week with varying levels of alarm. But we want to put those headlines into context this morning, which is why we are talking with a lymphoma expert, Dr. Mark Hoffman. He is an oncologist and medical director of lymphoma and myeloma here at the University of Kansas Cancer Center. Dr. Hoffman, good morning.
Good morning. How are you, Jessica?
Good to have you to talk about this morning. And I know you've seen this study. It's from researchers in Sweden, published in the journal eClinical Medicine. So help us understand how this study linked tattoos to lymphoma.
So why don't we just start with why they decided to do it, which I think is an important question. So for a long time, we know that when we remove lymph nodes in people who have tattoos, we often will see pigmented inks that have gone into the lymph nodes. And so it's pretty clear that your immune system has some sort of a reaction to the various substances that are in tattoo inks. The other issue is that there are some chemicals which are thought to potentially be carcinogenic that are in some tattoo inks. So there has been a thought that there is a potential link between tattoos and the development of lymphoma. So what these researchers did with a large public health database that they have in Sweden is they did something called a case control study, where they took a group of people who had lymphoma, we knew had lymphoma, and then they took a group of people who were what are called controls, which is a group of folks who have not had lymphoma, but who are broadly similar in terms of age and other demographic variables to the group of people that had lymphoma. And then they asked the question, how many of these people have tattoos? And then compared the rate of tattoos among the folks that have lymphoma to the rate of tattoos to people who don't have lymphoma. So that's the design of the study. It is retrospective. It's not looking at somebody gets a tattoo and then we figure out whether they're likely to get lymphoma, which would be a far more rigorous study. What the study found was there was about a 20 to 30% increase, depending on how you looked at the data, in your risk of developing a lymphoma if you had a tattoo. So I think there's a couple of things that are really critical to understand about what that means. Your overall risk of lymphoma is very low. So 20% beyond a low number is still a really low number. The other thing about the study is that you have to question whether or not it's actually true. And I would argue that it's really not entirely clear. If we're going to argue that it's something about the tattoo ink itself that is leading to the tattoos, one would suspect that the more body surface area you have with tattoo coverage, the higher your risk of lymphoma. That's in fact the opposite of what the study found. And so I think there's some sort of logical leaps here that are not entirely clear. The only other example I wanted to give to just understand how statistics can sometimes be misleading is probably one of the strongest repeatable statistical associations is that between ice cream consumption and increased murder rate. Now, does that mean that ice cream causes people to be more violent and want to kill each other? Is there something about ice cream that makes us all more violent and murderous? No. People eat more ice cream in the summer. There are more murders committed in the summer, and therefore there's a linkage. So when we see these types of epidemiological associations, you need to interpret them with extreme caution.
You explained that really perfectly, so thank you for that. This study, like most studies, concludes that more research will be needed. So I'll ask you to kind of predict the future a bit. In your opinion, what should those future studies do to either prove or disprove this potential link between tattoos and lymphoma?
Yeah, and I think it's a really hard question, right? So the effect size of this is relatively small, right? You're talking about 20 to 30% of a small number. And so in order to really start to look at whether or not there's associations, you need to look at much larger data sets. You need to look at different countries, right? Is the effect the same in Sweden as it is in Samoa? And you need to understand those types of pieces in more context. I think the study is interesting in the sense that there was a putative biological rationale. We see tattoo inks in resected lymph node specimens all the time. And now there's this epidemiological link in a single country case control study. And so I think the future studies will probably try and repeat in some way this type of study with a larger data set. And if it ends up being a repeatable conclusion and the same types of conclusions are made, then potentially there's a misunderstanding of the biology, or there might be actually a link here. But I don't think now is the time, if you're somebody that really likes tattoos, I would not be a person that looks at this study and decides not to get a tattoo. I don't have tattoos for totally different reasons, but I have zero judgment of people that want to have one.
Thanks for making that clear. And most importantly, how much ice cream do you eat? This might be, you brought it up. I got to ask now, so, with that interesting link you made.
Not enough.
All right. Fair enough. Okay. Dr. Hoffman, always great to see you. Thank you so much for explaining all that to us this morning.
My pleasure. You take care.
All right, we'll see you soon. So let's talk a little bit more about men's health with my two guests today, Dr. AJ Nangia and Dr. Jake Fantis. Both of them are urologists here at the University of Kansas Health System. But we should say right off the top that we know that men's health is not limited to urology. But we'll talk about that a little bit. But we're going to talk about a bunch more good stuff today. We're going to share a little bit of what I heard when I went out to ask men about their health. Kind of went out on the streets and asked some questions. We're going to start with this first question: do you talk with your friends about your health?
Yeah, but a lot of my guy friends are spread out now. But yeah, it's not always probably the main topic, but it comes around now as we're getting older.
Oh yeah, well, yeah, I think we're so I just turned 30, and our metabolisms are starting to slow down. So yeah, it's trying to find people who, will diet with you.
We talk about how we're feeling day to day. We actually share our concerns with, being too tired, being lethargic, not having energy. So yeah, we share all those things.
So Dr. Nangia, generally speaking, do you think that men tend to talk more about it or kind of keep it under wraps?
Well, judging by what you just showed us, they speak more about it than they used to. Even there's a generational difference. The younger generation, I think, speak more about it than the older generation. Stoic, we don't share our weaknesses. It's vulnerability. But I think the thing that I want to make clear, just like you said, is what we see in urology is a much more sensitive topic in terms of sexual function. When you talk about energy and you talk about lethargy, I'm like, welcome to the 21st century.
To anyone, men or women, right?
Right, and if you consider energy and lethargy as a sign of global warming in health, I will tell you that all of us are suffering from a problem, which is we're stretched, we're multitasking, we're on our phones way too much, we're not breaking away from any form of contact. And that's the bigger problem, and I think that, ironically, Jake and I were talking about this, that the reason we don't have a patient here with you today is because when we talk about what we see, men don't want to come on camera. If you talk about general health, absolutely, anyone will walk in the door and talk about.
Erectile dysfunction, guys aren't standing in line.
They're not going to
stand in line to be on
this program to be identified.
Dr. Fantis, what do you notice in your clinic and when you talk to men? Are you seeing a little bit of a shift in them talking more about it, even just with you as a physician?
Yeah, I echo the same sentiment. I think a lot of this is generational. I see men of all ages. I think younger people are a little bit more apt to discuss both sexual issues as well as overall health issues. Interestingly, I do find it sometimes that it's difficult for people to come in with one complaint, say it is problems with erections or penile curvature like Peyronie's disease, are actually reluctant to talk about other health issues. I screen everybody for mental health issues, which I think may be a bigger part of this puzzle, that we are not, they're not willing to disclose any difficulties with mental health when they're coming to see me for something that they think can be fixed by a simple pill or something else.
Do you guys consider yourself like the gateway? Because men might come to see you because it's really important. What you guys do is really important to maybe what they find important in life, versus like going to see their cardiologist or getting their blood pressure checked and so on and so forth. So therefore you capture them when you've got them in your office talking about mental health and making sure they're seeing their regular doctor.
Absolutely. I mean, being the gatekeeper is a strange position to be as a urologist. The gynecologists do that better than we do. It's often their first point of contact for women, right? Growing up, talking about everything. And for us, it's usually the last point, that they're already denying everything else, and they show up with sexual dysfunction, and you find out they've got terrible blood pressure, they've got terrible cholesterol, they're not all the usual stuff. And then you're the gatekeeper saying, go back to the gatekeeper, which is your primary care physician.
Yeah, and I mean, I started seeing my OBGYN when I was 18. I mean, men don't go to a doctor starting at a certain age, and therefore throughout their life.
Exactly.
Let's hear a little bit more about what I heard in the community. And this time we asked about if the stigma around men's health has changed.
As I've gotten older, yes. I think all men hit an age where we realize we are not Superman, and we do need a doctor's opinion. We might not like it. We don't always follow it because we are men, but we do concern ourselves with it. I know I do.
Raised as a man, you're raised to talk. You can talk about your internals and all that, but when it comes to your head, you're raised. Your dad teaches you that's a silence. You don't talk about it. And so it makes it real hard for men to do it. That's why it's got such a stigma to it, because nobody wants to admit they have the problem.
Maybe. I have friends who, don't want to even talk about prostate cancer. So hopefully it helps that I've kind of been through it and they see that, you can overcome it. So, but yeah, I have one friend in particular. He says, well, I'm not going to get jacked. Just the stigma about having the PSAs and the physical exams and that sort of thing.
Something they don't like to talk about, it makes them think they're weak, I guess.
Yeah, there's that word, feel weak. Is that really a real thing? I mean, no man's going to say I feel weak, but maybe there's that undertone.
It's what the other person said about how we're taught. Our football analogy, right? Get back in the game. Don't worry about concussion.
Yeah.
Just get back in. You're a soldier. You're a warrior. It's just how, unfortunately, and it's changing. Like the very first person who spoke just now, it's on TV now. From the days Bob Dole kind of didn't promote Viagra, but indirectly he did.
Sure.
To now talking about the curvature with a carrot on the TV and a bathtub for
I know. I said,
I'm like, every 5 minutes you're talking about things that, hold on, are we really talking about this on TV?
Do those commercials help then, do you think? Because now you're like, okay, I'm not the only one.
Yeah, and then there are other, men's health websites that now people can get online doctors for. It helps a lot, because then they walk in the door. Then we talk about the other things that really should matter, like stop smoking maybe.
More than the carrot?
More than the carrot. Stick in the carrot.
Gotcha. Okay, so Dr. Fannis, then, do you think, like that one gentleman said, he had prostate cancer. So once you've kind of gone through it and everybody knows you had it and maybe you feel more comfortable talking about it, do you think that helps then men kind of open that door to their friends and
yeah, absolutely.
have that conversation more?
I think, what you brought up with a lot of this direct-to-consumer advertising, having patients give their stories to friends and colleagues has been hugely beneficial in the sense it's getting the word out. I mean, that's what men's health awareness is about getting the word out so that people can come discuss these problems with their physicians rather than, dwell on them themselves, where you can have these issues compound. Things, again, I hate to keep bringing up erections, but, for what we do, this is what we see a lot of, and people, kind of these problems fester and they turn into more problems. Maybe it's high blood pressure, cholesterol that led to the erectile dysfunction, but now the problems in the bedroom are starting to lead to depression, and these things kind of snowball out of control, whereas the awareness of this and understanding how common these are bring people in, and we can get all of these issues addressed at one time.
Yeah, I mean, you make a good point. It's easy to maybe ignore heart issues or
Right.
something that's going on, or getting your skin checked for melanoma. But when it starts interrupting your physical and your personal life.
But just to put this into perspective, a bad joke. I mean, the penis is the lightning rod to the rest of the body. And what I mean by that, a Mayo study showed that men will start struggling sometimes with erectile dysfunction 10 years before their heart attack. 10 years. Okay, so that is how you, and of course it's the thing that eventually bothers the men the most, both physically and mentally, that they're actually willing to get in the door to be checked out and expose that vulnerability.
But what you're saying is that that takes a while to get to that point in life. So therefore,
point.
all these other things have happened, and all these other things have gone to the wayside.
Yeah.
You bring up something so important, because the mental health aspect is something that I feel like gets pushed to the side. I feel like it's come a little bit more around in recent years. I want to hear from both of you. Dr. Fandos, we'll start with you. Just what do we need to do to help men feel more comfortable talking about it with their doctors, with their friends, with their partners?
Yeah, I mean, again, I think what we're doing now, right here, and what has been done on television is just getting the word out. I mean, we talk about traditional masculinity in this country as hiding your problems, ignoring their existence, talking about they only happen to people that are weak. I think dispelling that dogma is critical in getting people to come into the hospital, explaining that, you know, erectile dysfunction affects over 50% of men as they age into their 70s and 80s, and certain subgroups way younger than that. Talking about the penile curvature, I mean, just to put that in perspective, some of our traditional epidemiological studies of Peyronie's disease said it happens to 1 in 1,000 men. And now we're realizing that number is probably closer to 10 to 15%, especially in some subgroups of men. And just showing how common these issues are, how correctable they are.
Okay, tell everybody what Peyronie's disease
so
is
Peyronie's
and why
disease,
it happens. Let's go there.
Sure. I mean, that is the bent carrot or the couch that's put at an angle commercial that people have been seeing. It's a deformity of the penis. It's acquired. You know, to make a long story short, it's just an abnormal healing process. Your body cells turn over all the time, and in this case, you have what should be an elastic tissue that stretches out, being inelastic in one part, which can cause all sorts of penile deformities, from curvature to indentations. But again, it's somebody's little member is not working as intended.
That's a nice way of putting it. But interesting though that I'm sure this didn't just happen within the last decade, because now we're seeing these commercials. This is something that's been going on and happens with men as they age. Is it just an age
first
issue?
of all, the name Peyronie's was named after a physician, Peyronie, who's French from the 1700s. There you go.
Thank you for the history lesson.
There you go. But my point is, people have known about it for centuries, literally now, right?
We just haven't talked about it.
We haven't talked about it.
So is it something that has to be fixed and taken care of, or gets worse and worse?
No, and I think that's the big problem. Is that, again, this direct consumer marketing is kind of a double-edged sword. When it gets the word out, it also puts fear in people. And again, I think that the fear should be motivated to get people in the door. I can't tell you the number of patients I see for Peyronie's disease where the simple answer is, it's not cancer, it won't hurt you, you're still functional, I wouldn't do anything about this. But just having some reassurance that this is, you know, not a disease that's going to cause them harm is important. But again, not come to the hospital allows it to snowball into things like depression, can turn into erectile dysfunction and other mental health issues.
Exactly.
And mental health, I want to hear just what your thoughts are on that, and just what you're hearing, and are we making strides and getting men to talk about it, and what can we do?
And I think, again, one of the people on the street said it best, is we just don't talk about it. We haven't. We do now. But is it a sign of weakness, or is vulnerability the sign of strength? And I think it's the latter, right? Because before we get suicides or major depression and homicide issues and mass shootings, I don't know where to say, but, you know, unfortunately, sexual dysfunction is hugely depressing, right? And we don't talk about that. It's like, if you're not a macho man, then, you know, you're nobody. And that can lead to all sorts of badness on the mental health side. That's why we're the gatekeepers on that side of things. And none of us truly, as urologists, are trained in mental health, which is why I often refer back to the specialists.
But you're somewhat perceptive when you know there's a problem.
That's right. That's the problem, is now we're aware, we can't ignore it.
Good. All right, let's hear from some more men in our community. This time we asked if they are staying on top of their regular screenings and checkups.
I got a psychiatrist and a psychologist there at KU. And my internal doctor is at KU. My back doctor, my neck doctor. And you can't, I've got a doctor for everything. But they're all at KU. I have the really, really good doctors.
I do. I see heart doctor every 6 months, and diabetes doctor every 4 months, and practitioner every 4 months. So, yeah.
You like that? You like
Love
the sound
it.
of that?
But just for him to even be on the camera saying that he's got a mental health doctor,
Yeah. Big.
huge.
It's big. It's big. So it starts with one person and then one person. And I know I spoke with that gentleman and he said, actually, we have a big group of men that we just check in on each other from time to time. And that's sometimes just enough, even if you're unable to get to a mental health professional. So we talk, Dr. Fantas, we've talked in the past, women typically go, we talked about going to the OBGYN annually. It's something that we've done since we're teenagers. Men don't always have regular checkup cycles going on throughout their life. What are we seeing as far as that goes?
Well, the SMSNA, which is the Sexual Medicine Society of North America, actually kind of expanded on some work that Dr. Nagia did over a decade ago and formalized a men's health checklist, which is really just a blending of urology and primary care and what decade of screening they're in, whether you're 20, 30, 40. And it goes from everything from blood pressure screening, cholesterol screening, when you get your colonoscopy, when you get your PSA checked, when somebody should be talking to you about urinary symptoms or erectile issues. And I think that being preventative rather than reactionary to healthcare is always the most important thing, because you can get to an area where you've prevented potential conditions. And again, what we see a lot of problems with erections stem from cardiac issues, untreated, unrecognized diabetes, unrecognized high blood pressure, obesity, the metabolic syndrome, things that could have been addressed decades prior rather than being on the back foot. So, talking about how we're doing right now, I don't think we're doing as good of a job as we should be, really making sure that people see their primary doctor or at least their urologist for their issues at a younger age to prevent problems as they get older.
Yeah, how important, Dr. Nagia, is it to be proactive than reactive and to start
huge.
that habit?
It's huge.
early?
I mean, I've always said this when I've been on this show. I didn't see a doctor till I was 40. And my wife dragged my sorry little ear in and made me go check up because she said, you've got to be around for me and for the kids. It's sad that that's what it took. But men don't go to the doctors because we're not having, menstrual issues or doing, even the breast cancer awareness is much better than prostate cancer awareness, the advertising. And many times it was your mother and then your spouse or partner before you ever did it for yourself. And that's still, I kind of think it's still the way.
Well, and also, like you mentioned, menstrual cycles and women seeing OBGYNs at 18, and then you get into having children young. So you're having I remember I didn't have kids till I was in my late 30s, but I thought, wow, like a full head to toe checkup. I mean, everything, the blood work and the heart and everything was checked up on. But when you have women who are having children in their 20s, I mean, you feel
That's
like
right.
you're in the system of getting checked up.
But again, that's evolved. I mean, I did research on HPV, human papillomavirus, back in the 80s, back in London. And then, which was in the process of developing a vaccine, which, to my heart's content, there is now a vaccine for men and women, boys and girls, from the age of, I think, 15, I think it is, isn't it? Yeah, up to the age of 45 now, that both now boys, or males and females, are engaging in early prevention, ultimately for an STD, a sexually transmitted infection, but also cervical cancer. So that's a male responsibility, like contraception. It's nobody's one-sided, but now that is blending into culture, that young people talk about it so much better than we did.
Dr. Fantas, do men care about STDs?
I'm sorry.
STDs, do they talk about it, care about it, check on it,
Yeah, I mean, again,
worry about it?
This is very much the reactionary nature of things. By the time they get to us, it's usually I've had an STI or I've had an issue. I'm having issues urinating because of a previous STI. Or I'm worried about this, and then this brings up all kinds of social dynamics, right? I mean, we talked again about mental health. We talk about infidelity. We talk about all of these things, but this is again a small part of a larger issue. But usually, by the time they've gotten to a urologist, there's a secondary problem with the sexual transmitted infection causing urinary or fertility issues. So we don't typically see them on the primary setting.
Couple quick things. When should men get prostate exams? What age?
So now the guidelines, I actually let Dr. Fantas speak about that. He just has been seeing a bit more of it. But certainly 45 is now the going rate, and 40 if you've had a family history, for both the PSA and the rectal exam.
Yeah, I think we've done a good job to try to take an invasive exam and back off on who we're offering a rectal exam to. If you look at a lot of the primary literature, the digital rectal exam has really disappeared as a screening tool. As urologists, I think we use it a little bit more sparingly depending on what a PSA threshold is. It's important that people do get screened for prostate cancer, and it's bad that sometimes this exam or the stigma of this exam has people afraid of going to be seen. And again, like, our job is to provide information to you about prostate cancer screening, and whether or not that exam is a part of it is a conversation that we should have, rather than just not coming in to get checked for fear of an exam.
And what about testicular exams? When to do them, how to do them?
Yeah, so that's even more controversial. You know, we've talked about this before, and there is actually no, in fact, the guidelines from the United States Preventative Task Force says don't do it. It's not indicated. It's more stressing than actually having the disease. I don't know. I don't think that's right. I know I don't. It's because there's not enough evidence out there to say that boldly. But I tell young men and anybody I see, just do it. And you know, most of them are doing it anyway.
All right.
So
we won't tell anyone.
We won't tell anyone. And just, you know, but in the shower, be deliberate. Feel what's like an egg, what isn't, what's soft. And if it doesn't feel right, fine. It might lead to a visit. But I'd rather have a visit for over care or over concern than not being seen.
So just get down there, feel around.
Check it.
Can't hurt anything.
No, I mean, we tell women to do breast, but even that, believe it or not, is a...
It's starting to get, you're starting to get away from that too.
Exactly.
But try to tell a woman not to do that.
Yeah.
You're not going to happen. She's going to do it anyway.
No.
So finally, let's listen in to some men from our community. I asked men, what is their biggest health concern?
Staying flexible. You know, keeping loose and being able to just be able to, you know, be able to go with the flow all the time.
Well, heart, weight, blood pressure, diabetes. As an African American, you know, all those things are vitally important to me.
Well, my wife and I have been thinking about this quite a bit lately. I would say for us, it's eliminating processed foods and really focusing on our diet. That's probably 90% of what we're focusing on right now, and being somewhat active during the day, but limiting processed foods, limiting seed oils, and that's kind of been what we've been focusing on lately.
I'm in good health.
Good.
I guess maybe blood pressure.
Do you get your regular screenings?
Yes, ma'am.
Yes, ma'am. Flexibility, diet, you know, some different interesting areas of health,
Exactly.
not just sexual dysfunction. It's certainly from the younger gentleman there talking about, you know, he was telling me how he goes online and looks for recipes and things like that. So you don't hear that as you used to. But I want to get to some questions here in a moment. So if you have questions, use the chat on YouTube or Facebook. You can find us on the X platform, or you can email the Medical News Network. Information is there on your screen. So some questions and comments. Jill wants to know, what should someone say to convince the man in their life to get checked regularly? Are there any magic words?
Yes, I have that, because I'm that older man who didn't listen.
Okay, what did
Right.
she say to you?
So I, basically my wife was pretty direct. She said, either get it sorted out or you're going to have a bad heart attack one day or a stroke. Wake up call stuff, right? That's what men do. We're just either all or nothing. So I've often said, as I see men now, I said, you remember in the old movies, the Rocky movies, when Balboa was going to fight Drago in the Siberian...
Rocky IV, yes, the best
thank
one.
you, but the
Don't
best
tell me
one.
when I said that.
There we go. And he puts a picture of Drago on the corner of his mirror, because that was a motivation. Annoyingly, men need that extra motivation. I don't know what it is, but whether
maybe a
it's...
picture of their kids and their spouse or their partner.
There it is.
Yeah.
That's what I tell them all.
Any magic words, Dr.
The magic
Pentis?
words.
Yeah.
Yeah, I think that this is all about control, and being able to be in control of your own life to some degree, to be able to make lifestyle changes and see a physician and have things where you can be proactive rather than having to be on 10 different medications in and out of the hospital. I think telling people to have some element of control really helps them come back and make sure they are evaluated.
Control, that's a good way of looking at it. And Jeremy brought up a good question just about money. Money is a thing right now. I mean, and as the man of the house or the woman of the house, you're often making decisions. Who's going to the dentist? Who's getting the copay? Who's, you know, how are we meeting these deductibles? And maybe how does money and trying to prioritize health when it comes to grocery bills and everything else you're trying to put on the plate?
I think the big part of this that you didn't mention is the lost work that somebody has to go to the hospital for. And I think that, again, being proactive and taking care of yourself prevents that week-long hospital stay that you had. Going to the emergency room with, you know, sweating, your heart, your chest hurting. You know, when people realize that this isn't a an investment, in the short term in that grocery list, in the, getting your teeth fixed, but it's more of an investment in the long term.
Yeah.
I think they're more apt to spend money to get checked out.
And it's hard to see it that way. We have a gentleman, a patient of ours who's going to come on our program, but yeah, young guy allowed testicular cancer to form into stage 3. Why? Because he has a job and he said, I couldn't get off work. I didn't want to go and find out because I knew I couldn't take the time off work. I couldn't afford to lose my job. That's heartbreaking. We got to change that. That's a whole other program. Ruth Ellen says, my husband's theory from his dad, old school, take care of your car or it's going to get worse. So why would the body be any different?
And I've joked about that before.
Yeah.
I said we're more likely to go get our car checked out and get an oil change than we get our own.
Yeah, the check engine lights comes on.
It's like, we've waited till the check engine light. We've got headaches and we've had chest pain.
Exactly. And we still keep driving.
And we still keep driving.
Still keep driving.
Till it falls apart.
Dr. Pandos, what's the big takeaway for anyone, for men listening, partners listening, spouses listening? What do you want them to take away from our chat?
I want people to know that they're in control of their own health in a lot of ways, and that, again, diet, exercise, weight loss, super important, but so is getting screened for conditions. I mean, there are genetic reasons why you might have elevated cholesterol or you may have high blood pressure that's not under your control, but it is something that's so important to get checked out and taken care of at a young age rather than having problems later on.
All right, I want to get to your takeaway, but tell us about the proclamation.
So we've had this over the years. It went from a week to a month. And Laura Kelly, back in 2001, created what we're talking about, a Men's Health Month. And actually, in this proclamation, which is done very, very well, it talks about everything we've just talked about. Everything about mental health and diabetes, blood pressure, and all of that.
Why is that piece of paper and that proclamation so important?
Because at least in the state of Kansas, like in many other states, what we have found is politics meets the road, and they're encouraging better health. Because then it leads to conversations like we're having today. Then we're all doing an aim of this month. There's too many months and too many weeks now for everything. Like my right thumb hurts week. Right. It's getting a little bit out of control. But this is us to be an awareness month for a reason. And I think that's the most important thing.
Quick question. My PSA is good. Should I get a rectal exam? I have to sneak this question in.
I'm going to leave
that. I mean,
right.
again, good is is challenging to interpret. I mean, there is data in this. PSA is less than 2, depending on your age. The rectal exam may find 2 to 3% additional cancers. But this is the conversation I think is important. I mean, I don't want to give this person specific medical advice, but when you see your clinician, you should ask that question. I think that conversation is what this is all about, not making assumptions, reading something and misinterpreting. Like, we know the data and we're happy to offer it to you. Whether or not you choose to have an exam is very much up to you.
But ask the question.
Ask the question.
And be involved in that conversation with your physician. What's the big takeaway today?
The big takeaway is awareness, advocacy. I think the people on the street, very educated. Actually, I'm very impressed. I mean, we see the people who come into our clinic. We don't see the population at large, unless we talk to our friends and encourage them of all that. So awareness is huge. Don't be afraid to be vulnerable. We all need help. We all need to be loved. And I think it's important to take care of each other.
So June is Men's Health Awareness Month. We've been doing this the last few years. Let's make it a date. We'll see you here this time, same time next year. All right, guys, thanks so much. Good to see you.
Thank you.
Thanks to our guests. Thanks to our viewers for being with us today. We'll see you back here on Wednesday. Coming up Wednesday on Open Mics with Dr. Stites. Larry Brown's little black bag stays with him 24/7. The battery pack inside is literally keeping him alive. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Life with an LVAD, giving patients like Larry extra years with his loved ones. Plus, how doctors explain the recent recall of these life-extending heart pumps. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.